very much for that introduction. So it is my pleasure today to present to you on road traffic accidents in Guyana. This will be during the period of January 2020 to December 2020.
Dr. Reid, can you please put on your camera for me?
Hello, I'm actually at work, so I'm having some difficulties with the camera.
That's fine. You can continue with your presentation, please.
Okay, thank you. So, objective: to give an overview of motor vehicle collision patients presented to the Accident and Emergency Department, A&E of the Georgetown Public Hospital Corporation during the period of January 2020 to December 2020. Motor vehicle collision worldwide is responsible for the death of nearly 1.3 million persons every year. And apart from that, it is also responsible for 20 to 50 million persons being injured. The injuries can also cause morbidity, which can reduce the quality of life of the persons affected. Over 90% of the road traffic deaths and injury occurs in low to medium to middle income countries. Guyana, being a middle income country, is also affected by these road traffic accidents, deaths, and morbidity. In these countries, in the low to middle income, they have about less than 48% of the vehicles in the world, yet 90% of the road traffic deaths or morbidity occurs in these countries. According to the latest WHO data, road traffic accident deaths in Guyana in the year 2018 was 128, which is 2.5% of the total death in that year. According to WHO, Guyana is ranked 94 when it comes to road traffic death per 100 persons in the world. This is 5th in the Western Hemisphere for road fatality. In Guyana itself, road traffic accident is one of the top causes of mortality. It is the #1 cause of death among persons between 5 to 14, and the #2 cause of death between persons 15 to 24. When it comes to overall causes of death in Guyana, road traffic accident ranks at number 18. Road traffic accident predominantly affect our younger population, and this is the productive population of the country. So it does not has a road traffic accident not only have a health burden on the country, it also has an economic burden on the country, because these are, especially the young adults, these are the productive members of society. And if they are affected by road traffic accident, well, then their productivity will decrease. And by extension, the productivity of the country will also be affected. So this presentation only look at patients presenting to the Accident and Emergency Department. Most of the deaths, or 50% of the deaths globally, that is caused by road traffic accident, these usually occur at the scene of the accident. These deaths happen between seconds to minutes of the event. These patients don't come to Georgetown Hospital. The remaining 50% of the patients who die as a result of road traffic accident, they die either on presentation to the hospital or after they have been admitted. We will just look at the patients who present to the accident and emergency. We will not consider the patients who would have been admitted and subsequently died. In January 2020, we would have seen a total of 123 patients arriving to the emergency department, secondary to trauma. Of that, 45 would have been admitted and 77 would have been discharged. The majority of the patients had minor injuries. And the ones who were admitted to the hospital, they were admitted with diagnoses such as polytrauma, mild traumatic brain injury, moderate traumatic brain injury, or fracture of long bones. We had one death during that period, January, and that patient had a diagnosis of polytrauma with pulmonary contusion. February 2020, we would have had a total of 121 patients presenting to the emergency department. 80 of them would have been discharged, 38 of them would have been admitted, and 3 deaths. This is 3 deaths in the emergency department itself. And like January, these patients would have been, the deaths would have been with a diagnosis of polytrauma, pulmonary contusion, cerebral contusion, severe traumatic brain injury. In March of 2020, during March, we would have had our first coronavirus positive patient. So in the latter half of March, the government would have instituted curfew and there were restrictions on travel. So what should be expected is a reduction in road traffic accidents. So in March, we saw a total of 103 persons being seen in the emergency department for road traffic accidents. Of that total, 84 would have been discharged, 19 admitted. No patient died as a result of road traffic accident in the emergency department. Like I said earlier, these statistics just reflect what happens at Georgetown Public Hospital Corporation, not what happens in the country. Because we have, even though Georgetown Hospital is the main referral hospital, we have New Amsterdam Regional Hospital, Diamond Hospital, Linden Hospital, Bartica Hospital. These hospitals would also see casualty patients. They would see patients who present there secondary to motor vehicle collision. And if these patients have injuries, severe injuries that is beyond the capability of the hospital, they would subsequently be referred to GPHC. In April 2020, we would have seen a total of 73 patients in total, with 67 being discharged and 6 being admitted. In April, we see a decline in the total number of patients presenting with injuries secondary to motor vehicle accident. And I think this is secondary to the fact that the government implemented curfew measures to restrict travel by the general public. In addition to this, most of the vehicle accidents which occur in Guyana is generally secondary to drivers being intoxicated and or speeding. With the curfew measures and the bars being closed, the likelihood of persons becoming intoxicated decreased. And I think that this had a direct effect on the reduction in the total number of persons presented to the hospital with injuries secondary to motor vehicle accidents. In May of that year, we saw a total of 87 persons presenting with injuries secondary to motor vehicle accident. We discharged a total of 84, admitted 2 persons and 1 death. The death is, in April, this death was a person presenting to the hospital in severe hypovolemic shock, and despite resuscitative effort, the patient eventually died. In June of 2020, we saw a total of 107 persons, 91 being discharged and 15 being admitted. We had 1 death in that month, but the cause of death was not documented. In July, 95 persons seen in total, with 87 being discharged and 8 being admitted. Like I said earlier, the majority of the patients coming to the emergency department who are being discharged, they have minor injuries. These injuries would range from fracture of the upper or lower limb, closed fractures that is, with the exception of maybe fracture femur or mild trauma to the head. Generally, the patients with chest trauma and abdominal trauma, they're generally admitted for at least 24 hours observation. In August, we saw a total of 77 patients, with 75 being discharged, 1 being admitted, and 1 death. Like the other years where we experienced patients who died secondary to injuries from motor traffic accident, the diagnosis is usually polytrauma. In September, we saw a total of 74 patients, 73 being discharged, 1 being admitted. In that month, there was no death. October, a total of 94 patients, with 92 being discharged, 2 being admitted. November, 112 patients we saw in total, with 100 being discharged and 12 admitted. At this point in time, September, October, November, we initially experienced a reduction in the total number of persons presenting to the hospital with injuries secondary to motor vehicle collision. But from September, we started to see an increase. This, I think, is secondary due to COVID fatigue, and persons were beginning to go out more, beginning to party again. So everything began to normalize. And This is why we have an increase in the number of patients presenting to the hospital with injuries secondary to motor vehicle collision. In December, and this is the highest total for the year, and we know why. In December, there's a lot of parties, lots of drinking, lots of speeding, so it is expected to have this increase in the month of December. We saw a total of 133 patients, with 127 being discharged, 6 being admitted. We had 0 deaths during that month. And this is a reflection of the year 2020. Of the total number of persons presenting to the emergency department, in the blue, those are the persons who were discharged. Red, persons admitted. And yellow, those are the total number of deaths. January and February, everything was normal. Mid-March, we had our curfew in place. And because of that, we saw a total reduction in patients presenting to the emergency room. But from September, we noticed a steady increase in patients to December. These are my references.